Hello. So today I'm really looking forward to this conversation because it's a conversation that really does need to be had. We're going to be talking about sex and sex changes and how we feel about sex during menopause. And this is something that a lot of women, I think, feel a bit nervous about talking about. I don't think it's spoken about often enough. Um, and also I think there is kind of almost like it's a real taboo subject to talk about, um, and quite often it's because we just don't know and understand what's going on and whether this is normal or whether it isn't normal. So today I am so glad to be joined by Claire, um, who is going to chat to us about this, and I'm going to learn loads as well, and hopefully she's going to share some wonderful information with us. Claire, thank you so much for joining us today.
Oh, it's an absolute pleasure, Meera. It's my favourite thing to talk about sex and the menopause, sex in general, but sex and the menopause. So this is an absolute delight for me. So thank you
Oh,
so
it's
much
an
for having
absolute
me.
pleasure. Thank you. So, I suppose we should start really by you introducing yourself to our listeners and kind of who you are and what you do and that kind of thing. And then we can go from there.
Brilliant. Thanks, Mia. So, I'm a medical doctor. I'm a doctor who treats people with breast cancer. That was kind of my day job for a long time. So I'm an oncologist and I treat people with breast cancer. And in the treatment of a lot of those women with breast cancer, we make a lot of them
Yes.
menopausal with the treatment that we give them. Either we give them chemotherapy and they go into an early menopause, or we deliberately make them menopausal and manipulate their hormones to make them
Yes.
essentially menopausal because they have a hormone sensitive breast cancer. So my initial interest in the menopause came from the fact that we were creating this situation for a lot of women who were cured of their breast cancer, but in terms of the treatment that they were experiencing, was causing quite significant problems
Yes.
for them. And we talk about it, but we don't really talk about it. And what we certainly don't talk about is we don't talk
No.
about the sexual aspects of that. So that was where my initial interest in the menopause
Right.
itself came from, was these women who I was looking after. And then I was having my own journey. So I had my own perimenopausal experience. And even with all of that knowledge, I didn't quite twig at the beginning that that's what was happening to me. And at the same time, I was also training to be a somatic sex coach. And the more and more I got into that work and actually working with people's bodies and helping people to understand how their bodies work, and helping people to create the sex lives that they wanted, I then began to realize, okay, I love the menopause and all this stuff. I've got all this sex stuff over here, but actually nobody's talking about
Of
sex
course.
and the menopause.
Yeah.
Not really. And then I thought, oh, this is perfect for me because it takes all my interest in sex and sex therapy that I do over here, takes my interest in the menopause and brings it all together. So that's where
Wow.
I've come from in terms of my experience of why I'm so passionate about sex and the menopause. Mainly, it started from
Yeah.
my patients, but actually then became my own personal experience. And then the realization as I started to move into the menopause space that nobody was actually even talking about sex, and that's something I love and know a lot about. So that's where it all came together, and the unholy matrimony, I call it, of how it all came together, and how the pleasure possibility
Yeah.
came to be. So that's
Oh
how I
gosh,
got there.
that's it's an amazing journey, but one that makes complete sense. And it's interesting because I've been working recently with a couple of clients, who, one in particular actually, who was saying exactly that about, she's, a breast cancer thriver, as she calls it. And she was explaining how little information was given to her, how little she understood about what was happening to her in her body. And then also speaking to another lady recently, and I did an Instagram live with her actually, she's a radiographer, and it's for an organization called Sakun Through Cancer, that I did this live, and we were talking about menopause. And she also said, as a radiographer, she had no information to give these women or even signpost them to anywhere. So actually, that's a really interesting topic in itself.
Yeah.
That kind of the menopause and breast cancer. Um, but I love that that transition led you to where you are today, because and your own personal journey too. And I suppose I really want to start by asking that question. Why do you think we don't talk about sex and menopause, or sex at all, really, but and menopause together? Why are they not grouped? Why don't we make that connection? What's kind of What's
What's in
happening?
the way? Yeah, I think
Yeah.
we don't talk about sex in general, so we've got to start there. And actually, when people come to work with me, we actually have to start way back. It's not about actually what's happening to you right now at this phase of your life, because all the things that have happened along the way have led to this point, and the menopause has just added something on top of all of that. So usually we have to unpick a whole load of stuff before we even get there. So there is just societally, it's not something that we talk about. We're not comfortable with. I think the younger generations are. I've got teenagers, and I think they are more open and aware, and certainly more comfortable to talk to me, for example, than I might have been had it been my mother. So I think there are things are changing. But so you've got all of that in the background anyway. People of a certain age with a certain type of sex education and a certain type of way they were raised, and all of that. And then you've got the menopause on top of it all. And sometimes I think by that point, for many people that come to see me, actually the sex has fallen to the bottom of the list anyway.
Mm,
So there's something about now I'm having this experience. It already kind of fallen to the bottom of the list, depending on whether you're in a long-term relationship or you've been a long-term single or whatever it is. And I think there is also a little bit of a myth that, oh, well, maybe that's it all over as well. So there's lots of different narratives that are mainly just conditioning, really, to be honest, about what it is that we believe to be possible.
yeah.
But I think we've already fallen to the bottom of our to-do list, and by that point sex just feels like a stretch too far on
Yeah.
top of everything else. And then I think the crucial thing on top of all of that is people are having experiences in their body,
Mm,
but they don't think that they're real, or they can't be true, or nobody's talking about it and it must only be me, and all of those kind of things. So women will come and they'll tell me about pain and dryness and loss of sensation, and it just doesn't feel the same down there, and they think they're the only one. And because we're not talking about it, all of a sudden they think they've got some kind of dried up monster in their pants. And because we're not talking about it, everybody's too embarrassed. So there's all sorts of things playing into it. Some that are old and historical and we've brought with us, and some that are very unique to this, which is actually, it is likely that your vulva is changing. You're not imagining it. And for someone to say that out loud, it feels like it can't possibly be true. So because we're not talking about it, feeds this sense of, oh, actually, it must just be me.
yeah.
The question I get asked all the time is am I normal? Doesn't matter
Yeah.
what it is we're talking about, is am
Yeah.
I? And everybody, in my experience, is usually normal of some
Yeah.
description. But
Yeah.
that's what's getting in the way. It's the actually not willing, not able to actually, and not having the spaces, the spaces that feel safe enough to have those discussions, which is what I'm passionate about, making the spaces where people can say the thing.
Yeah. Which is so important. And I think it's so valuable. But sometimes I also think, Claire, that we don't even have the language,
Mhm.
right? We don't even have the terminology and the language to understand what bit of us isn't
Yeah,
feeling the same. Because quite often
yeah,
it will be sort of down there, or,
yeah,
it will be words and names given, to our genitalia. And
yeah,
actually, one of the things I will say in my menopause, any workshop that I do, when I go through the list of symptoms, I will always include in there, your genitalia will change.
change,
There
yeah.
will be a change.
Yeah, and I
There
think
may be a
that's
drop,
that's a
there'll be a
really
dryness.
interesting that's a really interesting part of some of the work that I do with people. So we use this term that we call the genital hole. And what that means is that actually if I ask you to close your eyes and imagine your left pinky, for example, you can probably close your eyes and
Yes.
imagine and feel
Yeah,
into your
yeah,
left pinky. If I say to you,
absolutely.
close your eyes and imagine your left labia, most people can't do that. So when there's this hole, it's almost like we exist
Yes.
from the head to the top
Yeah.
of our pelvis and from the top of our legs down, and we don't actually have a felt sense or an experience of our genitals. And
Yeah.
particularly for a lot of women, they might never even have looked, and they don't even know what they
No,
look like. So when
no.
things start to change, they don't have a benchmark. They don't have something to compare it with because they've never looked. They may not have a self-pleasure practice in which they actually touch themselves routinely, so they don't know what it feels like. So they're having an experience and they don't really have anything to compare it with. They just know that something's not quite
Not
right.
right.
But what you're explaining about we don't have a sense of and we don't have names for is really, really common. It's almost as
Yeah.
if we stop at the pelvis and start at the
Yeah.
top of the
Oh, yeah,
thighs.
yeah, yeah, yeah. And I mean, I obviously I speak to a lot of women from many different cultures, but I know within the South Asian community
Yeah,
in particular, women's health is like the last thing on the list anyway. And it's forbidden, it's bad
yeah,
to talk about, to think about, anything to do with
yeah,
sex or babies or anything to do with your periods, or female genitalia are
yeah,
just not on the radar at all. And if you do talk openly about it, gosh, that's just terrible. And I think, as you said, same for me with my children, my girls. I've got two girls. I was very, very keen to make sure that it wasn't that when we talked about having sexual relationships, when we talked about sex, when we talked about their periods, or when they were able to come and talk to me about pain, or it didn't feel right, or anything that happened to them, I have to say, and I have to be honest, that actually sometimes there are moments where I feel a little bit uncomfortable,
Mm.
and I have to kind of go, okay, don't be uncomfortable,
Don't let it show. Don't let it show.
don't let it show, don't kind of go, what? And I'm like, okay, no, it's okay, it's fine, just kind of grin. And so, but that is also there too, because of my upbringing and
Yeah.
how I was. And I think, okay, not having the words to be able to describe something is one thing. You then also got, because you don't know what's going on, so you can't even describe it. Then on top of that, you've got these menopausal symptoms like the dryness, but also the hot flashes, and the loss of confidence, the anxiety, the palpitations. You're getting things like hair loss, you're tired. All of that stuff is just like, quite often the women will say to me, the last thing on my mind is having sex with my husband. And if I do, it's just because I almost feel it's a sense of duty.
Yeah.
I just oh, really, that's kind of the whole thing. And do you find that a lot? How do we change that? How do we help women with that?
I think so. My experience of working with people like that is that that what you said there, that what we call the guilt sex. So I'm having sex because I feel guilty if I don't want to have sex.
Right.
I mean, and that's really, really common in my experience, because we have this sense that sex is for and with someone else. And
Mm,
often we are conditioned to believe that men want more sex, enjoy more sex, all sorts of other messages that we got, need sex, for example, when actually the vast majority of that is absolute nonsense. It's just things that we have internalized from the cultural beliefs that are out there. And in terms of helping people to move forward, I'd completely flip on a script and say, what do you want? Because what we find is women tend to be overgivers, people pleasers, all of the things that go with that, and have become habituated by this point in their life to putting everybody else's needs first.
yeah.
So actually, one of the main things I start with what do you want? And of course, when I say to people, what do they want? They don't know. And
No.
that's okay. That's a great place to start, but at least know that you don't know what it is that you want. And then working with that to establish, well, okay, you don't know, but if you could dream, if you could imagine, what would it be? Because we can't achieve something that we don't even know what it is. So if people are sitting in that place of having guilt sex or chore sex, then actually it's easier, rather than trying to get them out of that, is to say, okay, well, what would you like? And then for them to realize that they don't even know what they want. And then we need to work with that. Okay, why the bottom of your to-do list? What is it that would make the difference here? What is it that, if you could have anything you want and we could wave a magic wand tomorrow, what would it be? Because once we know that, once we know what people actually want, then we can work backwards. Because the last thing I think people at this stage in life need is to then have another should on top of everything else. Well, I should want this, or it should look like that. And I say to people, it doesn't have to look like anything at all that you don't want it to look like. But we need to get really clear, first of all, is what is it that you want? Because then we can try and work towards making it happen. But often when you ask women, they don't even know what they want. And that's where we need to start.
Mm, yeah, gosh, that is so interesting, isn't it? Because we're never really asked that. We're never really, we're never given that power. We're never given that control back. Because and during menopause, you feel like you're losing more control than ever. You're
Yeah.
completely changing. But is there a reason why that's happening? Is there a reason why our libido might be lower and we just don't feel like having sex anymore? It all feels
So
different.
I think there's a lot of combinations of things. What I see often now, particularly in the menopause space, is just have some testosterone and it'll all be fine. So as
Yeah.
we know, in addition
Yeah.
to In addition to thinking about the fact that we're losing estrogen, and that's got the biggest impact
Right.
because the estrogen is what is. In fact, I'll show you actually because I brought my vulva pocket. So this is
Hey,
Verity. This
fantastic.
is Verity the velvet. I'll move back a little bit so she's in frame. This is Verity the velvet vulva. I don't go anywhere without my vulva. And the important thing to understand in terms of the estrogen part of it to start with is all of these tissues. So if we imagine this would be outer labia, so that's the parts
Yeah,
that are covered with hair. This is the inner labia or the inner lips. You've got the clitoral hood here and the clitoral glands, which is underneath. And then you've got the vaginal vault itself with the G-spot in here. And then between the clitoris and
yeah.
the vagina, we have the urethra. That's where we pee out of. We do pee out of somewhere separate. There's still people who come to me in their 50s that think they're peeing out of their vagina, but we're absolutely not, just so we're
No.
clear.
Oh gosh,
So
wow.
all of these tissues in your pants and the things above it, so the pelvic floor that's holding all of this in place and the bladder, all of these tissues require estrogen to work well. At the
Right.
menopause, when the estrogen is falling, these tissues, which are the most sensitive in the body to estrogen, are beginning to die off. That's what's happening. So you are losing tissue, you are losing sensitivity, you are losing lubrication. All of those things are absolutely real. You're not making it up in your head. It's
Wow.
absolutely real. So all of these tissues themselves are beginning to die off or atrophy. You may have come across
Yes,
the
atrophy,
term vulva
vaginal
vaginal atrophy. So atrophy
atrophy.
just means dying off. So all of these tissues are dying off. So they're not working as well. So who wants to do a thing with a thing that's not working very well, that's comfortable
Yeah.
and painful and all of those kind of things? So that is feeding into our level of desire. So if you are not going to desire or want for something that you know is going to be painful, so there's that piece. There is
Mm.
then, in addition to the estrogen that's falling, that's the levels that are falling, our testosterone levels are falling. But actually, in truth, our testosterone levels are falling from our late 20s, early 30s onwards. It's not purely a menopausal thing. But
Right.
often I see, I'm just going to get some testosterone and this is all going to be fixed, and a huge amount of disappointment on the other side of that because our sex, our want for, and our libido, if that's the word we use, or our sex drive, which isn't a drive, we'll come to that bit in a minute, isn't purely driven by hormones. It's driven by many different things.
Right.
Testosterone may be one of those, and it is helpful for some women in some contexts. But testosterone is not going to fix the fact that you're in a marriage that you don't really want to be in, or your job is particularly stressful, or your teenagers are a nightmare, or you're looking after your elderly parents, or you're too tired. Testosterone isn't going to fix all of those things that are in the mix in terms of whether we feel that we want to have sex or not.
Yeah.
And one of the things that I find probably a couple of the most useful things that I tell people is we have this sense that sex drive is a drive. So that this idea that we will suddenly, out of the blue, whilst standing with a marigolds on at the sink, be overcome with horniness and want to have sex, right? So that's the idea that we're presented with, that
Yeah.
that's what should be happening, that
Oh
that's what
gosh.
sex drive looks like. Now, what we know from research is that for the vast majority of people in male bodies, that is how they may experience their desire. Not totally, but in general, they have what is called spontaneous desire. That means
Right.
it comes out of the blue, not necessarily out of the blue, but it's something that arises in you and you notice and you're driven to want to engage sexually with someone. So for the vast majority of people in male bodies, that's what it will look like. What we know about people in female bodies is that they experience what's called responsive desire. So
Right.
rather than something that comes out of the blue, what happens is we start to notice that our sexy things going on, we feel something in our body, and then we think, oh yeah, this feels good, I want to be doing this. Now, the reason that's important is because if you are standing waiting for a bolt of desire to the fanny, as I call it, it's not coming. It was never coming. And actually, you might never actually even have experienced that in your younger years. What most women have is what's called responsive desire, which means when things start with it, when things we start to think about it, or we make time for it, or we make room for it, or we allow our imagination to go there, then we will start to experience a sense of desire.
Yeah. Yeah.
And the reason that's really important is because you need to put the content, you need to put yourself in a situation where you can then experience desire. If you're waiting for it to come and hit you, it's not coming. However, if you put your body in the bed, so the other thing I say is people will come to me and say, oh God, we haven't had sex for ages, and then eventually we get around to it and I didn't really want to do it, but I loved it. Why don't we do this more often? Which is what people tell me all the time. Actually, when I get into it, I really enjoy it and I wonder why I don't do it more. That is responsive desire. That is the sense of you might not necessarily spontaneously feel it out of nowhere, If you didn't before, you're not going to now. Even if perhaps you did before in your younger years, you may feel that less when our
Yeah.
hormones start to change at this point in
Yeah.
time.
Yeah.
But what you actually want to do is you have to realize that if you want to have, and you might not want to, but if you want to have a
Yeah.
sex life that's fulfilling and is meaningful to you in some way, you have to create it. It's not something that's going to come to you from the outside. And I use the phrase, it's a phrase actually from Emily Nagoski's book, which is called Come As You Are, that she uses, that is, you need to put your body in the bed. Because once you make the container and the time and the commitment to it, you will probably enjoy it.
Yeah.
If we've dealt with all of the other things, the pain and the dryness and all the other stuff.
Yeah.
But in general terms, in terms of just the desire piece itself, it's
Yeah.
not coming to hit you, and you need to commit to it. And that's where the best, in my experience, in terms of the couples I work with, the people who create the kind of sexual expression that they want to have in a relationship have worked at it and commit to it. It's not going to happen by magic.
Yeah. No, yeah, I can see that. I can hear it. I can see that in my own context. I can understand that actually as a woman, it's about the situation, it's about the build up, it's about the creating of that environment. And yeah, definitely. I think most women that I speak to as well, and I say this is I would say most women, I'm not going to generalize, but yeah, it is all about kind of the timing, the mood, the how they're feeling. They might have been on a night out or something, and we'll have the girlfriends calling back and go, on our way back home, we're like, right, messaging each other, and sort of like gearing each other up to see what, but that's kind of how it I can see that kind of works like that. Whereas for the men, it seems to be slightly different, the way they
it is, and we know that from research. We know that that experience is different. And the other thing is, when it's quite the context in which, so what you're saying is the context of it is important. But we can't expect the context to happen by magic. We can't just expect
you've got to
stars are going to align and the perfect context is going to appear for you, because the truth of the matter is that isn't really how it works. So if people want to have sex lives that are meaningful, scheduling sex, people hate that idea. It works an absolute treat. Schedule it in the diary, make some decisions, make some commitments about what you want to do. And also on the side of that, if that's a partnered relationship, is what is your relationship with yourself and your own relationship with self-pleasure? And that's a whole other, the courses that I run have a whole piece on self-pleasure and masturbation and how women of a certain age might view all of that and how we can start to work with some of the things that they believe about that they've got with them from childhood and all of that stuff. And actually the importance of self-pleasure. And actually, in addition to all of that, in terms of just vaginal and vulval health, how important it can be to have an experience of arousal and orgasm if that's what you choose, because that's actually very good for you. It's very good for your genitals, increased blood flow, all of that stuff is actually very helpful. But again, sometimes that just feels like a giant addition to the to-do list. So there's got to be a payoff. It's got to be worth it. And some of that is about committing to it.
Yeah, no, you're totally right. I think, again, there are so many women that I've spoken to, and I have many friends, and for some, their sex life is absolutely thriving, regardless of menopause or not menopause or whatever. And some who just kind of, like, well, it's just not right for me. And but I think in both instances, the thing that I've noticed is that communication with their partner, whoever that may be at the time, if they're within a relationship, is absolutely key. But also, as well as that, and you touched on this just a bit, was the practicality. Right. Sort of, I suppose perhaps the listeners and people, might want to know about the going back to the masturbation in a minute, but just on that practical level, that practicality is whether it is masturbation or whether it is having, sexual intercourse with a partner. It is about that. How do we, on a practical level, make it not painful, make it more enjoyable? Yes, we've talked about the mood and the surrounding and the context and the whole thing, but how do we do that? Because if it's just painful to have sex, then it doesn't matter what you do, it's going to be painful to have sex.
The first part of all of that is the idea that real sex is penetration. That's the first place to start, is this idea that actually it's only sex if you're in a heterosexual relationship where there's a penis and a vagina, and if it isn't that, then it isn't sex. And actually, if it isn't that, it's not good enough, and if it isn't that, he'll not be happy, and all of that stuff. So there's all of that thing that needs to be looked at, because actually, if you find yourself in a situation where you have the genitourinary syndrome of menopause, which is the over-encompassing term that we now use for the vaginal atrophy that we've spoken of, that is extremely treatable. Extremely treatable. Okay. So as we showed on the puppet, all of that is to do with loss of estrogen. So if you have estrogen replaced, the vast majority of those tissues will recover. So whether you choose to have HRT, full HRTs, patches or gels or tablets, is one thing. If you don't want that for many reasons, and there might be reasons why you don't, most people can still use vaginal estrogens locally. So that means putting the estrogen directly into the vagina, usually in a pellet or a cream. And that is not absorbed into the rest of our body, or a tiny, tiny amount that we're not worried about is absorbed into the rest of our body. So even my patients who've had a hormone-sensitive breast cancer, for example, if there are if we've tried other things that are non-hormonal and they're not having any luck with any of that, I will still prescribe hormone preparations to my hormone-sensitive breast cancer patients if we're just using it locally in the vagina, to give you an idea of how unbothered we are actually about the systemic absorption. So that's the absorption into the rest of it. It is extremely effective. Extremely effective. Oh, wow. So, and there's a couple of things to say around that, which is, as we know, many of the symptoms of the menopause can last for a long time, but many of them will get better with time. So hot flushes will settle down, insomnia will settle down, when the hormones and things all settle down, most of that will settle with time. What we know about vulvovaginal atrophy is it will not get better with time, because the tissues are dying off. There's no way for them to get better. So what I say to people is that if you are having symptoms of dryness or pain, don't wait, because it's easier to maintain what you've got and get some improvement than if you leave it for months or years and those tissues have died off even further. So it will not get better with time. And that's one of the things I really, really, really want people to know, is that actually, if it's something that's bothering you now, it's going to be bothering you in 6 months' time, and it's going to be bothering you in 12 months' time, and it's going to be bothering you in 5 years' time. It's not going to get better, and you don't need to tolerate it. And the treatments are extremely successful, and they're very safe. So the practicalities of some of that is, if you're somebody who's decided for whatever reason that you want to use natural and nutritional methods to manage your menopause, and you don't want HRT, but you're having this particular problem, you can have local vaginal estrogen for that, and you don't need to. Even women who choose to use full HRT, about 25% of them, so 1 in 4 people who are using HRT, will still have the vaginal problems and might need additional vaginal estrogen. So again, even if you're choosing HRT, you might still need to be topped up locally with vaginal estrogens. And that's something you can talk about with your GP. They're really not difficult to use. They're extremely effective. And don't wait, would be my advice around the practicalities of some of that. So that's managing it with hormones. The two other aspects of treatment, one is vaginal moisturizers. You moisturize your face, you moisturize your fanny. That's how it goes when you get to our age. So there are different types of moisturizers for vaginal use, and they're usually quite long acting. So you might only use them 2 or 3 times a week. Right. And they have compounds that cause the moisture to be retained within the vaginal walls itself, in the walls of the skin. And they've got hyaluronic acid in them, which is stuff that we do actually use on face creams. It helps to hold moisture in the vagina. Right. So you can use them along with vaginal estrogens, should you choose. You can use them on their own. And they are a completely non-hormonal method. So somebody who doesn't want any hormones at all, you can use long-acting vaginal moisturizers. You can buy them over the counter, and you can get them on prescription. So that's the second one. And the third one is lube. And actually, it doesn't matter what age you are, I talk to people about lube, because again, we have this onerous expectation of our body that it should perfectly lubricate every time exactly where we need. And that's just not how it goes, no matter what age you are. Everything feels better with lube. Everything feels, whether that's self-pleasure, whether it's pleasure with a partner, whether you're using a sex toy, doesn't matter what it is, everything is better with lube. And think carefully about the type of lube that you use. So be thinking about something that is pH balanced.
Yeah.
So one of the other things that we know is that the pH of our vagina changes after menopause, and the bugs that grow in the vagina change. So we need to be thinking about monitoring the pH and just thinking about the quality of what it is that you're putting inside yourself when
Yes.
when you might already be having some delicacies and some problems and some pain down there. So lubrication on everything all the time.
Brilliant. I mean, do you know what? That is just such brilliant advice. Such brilliant advice. I think everybody listening, who whatever stage, phase, whatever you're going through, is going to find that absolutely so useful. Because you've just in that, well, I mean, the whole so far, you've just really busted so many myths already, and they're, like I said, just not spoken about at all and not touched upon in detail. And actually such an important part of so many women's lives. As you said, whether it's for self pleasure or it's for pleasure with another partner, it doesn't really matter. It's just it can be such an important part of your life to actually kind of just dismiss it and just go, well, I'll just live without it, or I'll just do because it's just too much. There's with so many options that you've mentioned there, but can be, as you said, it's so easy.
Yeah, it's
To sort
actually
out.
really, really easy and satisfying to
Yeah,
treat because it's actually really, really effective. And of course, on the other side of this, if we're talking about people in partnered relationships and heterosexual relationships, then your partner might also be having, partners are also partners of a certain age often, and they be having their own issues. And, it may be that actually they may be having issues with, say, erectile dysfunction. It's a horrible term, but basically, I mean, they may be having problems getting and maintaining an erection, which brings a whole other layer of
yeah,
things, which if you're not talking about it, just becomes this thing you don't talk about, and it becomes a wider and wider wedge, and nobody's getting what they want. And actually, I deal with many couples who have a very successful fulfilling sex life that doesn't involve penetration at
no,
all.
yeah,
So there's lots, it's starting to think about some of the work that I do with people is about getting them to expand their repertoire of things that they find pleasurable and actually
yeah,
focusing on pleasure in this. I mean, this is the most amazing machine for
yes,
experiencing pleasure ever.
yes, yes,
Um, and most of us have never had an instruction manual and don't know what to do with
no,
it, and
no,
don't really realize that there's so many things that are available to us there in pleasure and intimacy and connection, because that's usually what people are looking for
yeah,
from, at this point in their life. If they've been with a partner for a long time, it's the intimacy and connection and being together piece. You
yeah,
can create all of that without penetration ever, if that's
yeah.
what you want.
Yeah, totally. Gosh, it's been such a fascinating conversation. I've just loved this and I knew I would. I've learnt so much. I literally have learnt so much that I can pass on to my clients and get them to listen to this podcast because it's going to really give them a lot of information. And even if they don't want to have a conversation with me or with anybody else, you've actually passed on the information
Yeah.
to them. And yeah, it's okay to talk about it. It's okay to have this conversation. And it doesn't have to be one way or another way or this way. And do you know the thing about menopause, and I think particularly post-menopause, because peri can be a little bit tough for some people. But post-menopause, that that exploration you were talking about, you feel so much freer. There's a real sense of freedom once you get to that postmenopausal stage. It honestly is. Anybody listening who's going through perimenopause, just hang in there because postmenopausal now, and there is just this sense of like whatever went before just isn't particularly relevant and doesn't really matter because you're suddenly left with this body that is slightly different. Your mind is different, your body is different, and you just don't care anymore. And actually, that's a great time to start exploring and a great time to think about things in a very different way than you were brought up to think about, and
Yeah.
breaking those taboos. So it's fantastic.
Yeah,
I love it.
absolutely. Yeah, brilliant. And I think there's so estrogen is the people pleaser hormone. So there is
Yeah,
something that is the effect on our brain in terms of connection and community and all of those things that are the things that keep us that make us caretake and tend to everyone else. And actually, that we know that on the other side of that, people give less of a monkeys, to be honest, because they're not, because actually the estrogen going actually also changes something in our brain
yeah,
also. and
Yeah.
we care less, and we're more adventurous, and we want to do more things. So there are great things as well on the other side
Absolutely.
of the menopause, but equally,
Yeah.
you don't need to tolerate all the stuff in between. There's ways to
No,
help you manage all the in betweeny bit that
exactly.
can feel really pretty rough. And
Exactly.
particularly around this vulvovaginal atrophy bit, because it's not going to get better. It's not
No,
something that's magically going to get better on its own,
no.
because it is purely relation to estrogen loss and tissue
Estrogen.
loss, and that's not
Yeah.
going to come back. So
No,
that's not that. I don't want people to think that they should be tolerating that and they hope
no.
that something, because that bit definitely won't.
Yeah. And women do, we do, don't we? We just kind of put up with it, or you're told just put up with it. It's fine. And I hear women who are, can't wear jeans or can't even wear
Yeah, yeah,
pants,
yeah, yeah.
can't wear because it's just so painful. And I'm like, wow, that's just heartbreaking that that's how bad it is. And you need to seek some help because, as you
Yeah.
said, it's there is help available. So yeah, definitely, I think the message is to seek help, and there is so much that we can do. There is so much
Yeah.
help out there. Don't suffer in silence in anywhere. Claire, it's been lovely speaking to you. I would really love you to share how people can get in touch with you should they
Yeah,
wish
of
to.
course.
If you've got any social media places, whatever, wherever it is that they can actually get, reach you, if you've got a space where they can contact you, and
Yeah,
ask those questions if
perfect.
they need to.
Come and join us at the Pleasure Possibility Facebook group. So it's a closed group. It's
Yeah.
purely for perimenopausal and menopausal women to talk about sex. That's all we talk about, really. That's what it's about. And it's called the
Fantastic.
Pleasure Possibility because we have to be available to the idea that pleasure is possible for us at this point in our life.
Yeah.
And people come and they get support from other women. I'm there so I can give specific support. Go to your GP and ask for this type of thing. And people come back and tell us their wins, and they come back and tell us I had sex for the first time in 5 years. And I mean, it
Oh,
really is a lovely, lovely supportive
fantastic.
space. So come find us. The Pleasure Possibility on Facebook is probably the best place to get hold of me, and I'm there, and people can ask me things directly there.
Oh, that sounds amazing. I'm going to join. I'm definitely going to join.
Perfect.
Get
Do
off
come and
this
join
when
us.
when I get off this podcast, I certainly will. That sounds amazing. Thank you. You've been so wonderful to speak to. But before I let you go, um, there is a question we ask all our guests,
Okay.
and it's around really sharing something that um, you feel is something you cherish, whether it's a ritual or a habit or whatever that you really cherish, and you would love to share with others, and perhaps that by sharing that they may be able to also enjoy it, and you never know, it might kind of change things for
Yeah.
them.
Okay, this is a really well. Actually, it was quite difficult. This is quite a difficult one for me because there's one is, do I mention the green smoothie? But actually, that's not what I'm going to say. What I'm going to say is, I'm going to say having a self pleasure practice, a self pleasure ritual of setting aside. Doesn't matter how long it is. It can be 10 minutes. It can be 2 minutes. It can be half an hour. Once a week at a minimum, to just be with your body with
Mm,
no intention, no specific orgasm goal in mind, no specific I have to achieve in anything, to be with this body and to engage in experiencing the pleasures that it's got to offer you with your hands and toys if that's what you want, but to be with your body in a self-pleasure ritual. Light a candle, set aside some time, put a sign on the door, whatever it is that you need to do, but set aside some time where you can just simply be with your beautiful body that's capable of immense pleasure just for you. That's
mm,
my well-being, self-pleasure. That's
yeah,
what I
I
do.
think
Yep.
that's such a beautiful bit of advice, and something that I think we just do not do at all.
No, no.
Doesn't even come on the radar for so many
Yeah.
women. So yeah, I think that sounds absolutely wonderful. And yeah, thank you for sharing that with us. It's really thought provoking, and actually makes you stop and think that actually sometimes it's all of this we talk about self-care, and
Yeah.
somebody will get their nails done, and somebody get their hair done, and somebody will do this, or they go for a massage, but actually it can be, I suppose it's not as it may not be simple for some people, but it can be as simple as literally what you've described, and exploring your body and enjoying it. So thank you so much for joining us, and thank you for
Oh, it's been
sharing
a
so
pleasure,
wonderfully
Meera.
with me. Oh,
Thank you for having me.
thank you.